Okay, so I had some questions about the competency sheets, and I do apologize. I had meant to do this at the end of class last week, and it just slipped my mind with having the guest speakers. So one of the things that we have all noticed as the faculty when we are going through working on self-study documents for next year is that we have to have a good log of when you have learned and practiced each of the competencies that are associated in each of the clinical classes. Written down and in a much more specific way. And so what we decided as a whole to do were these sheets. So in your assignment, you saw the sheets that had like standard 70, and then one of them was like wound care. And then it had on the top practice or learn, and then the bottom it said assess. And so what this is going to do is you have to have a log of each and every one of these, but obviously we want multiple times. So I'm going to kind of explain what they are and then explain how we're going to move forward with this. So let's talk still about standard 70, which is wound care. So in all technicality, that does not have to be suturing. That can include suturing. So think of steri strips, and we'll use that as an example. In class, we are going to learn about the technique. So at that point, I, as an instructor, can go in and sign off that I have seen you practice and taught you about the technique. Then you're going to go in, and let's say we have a skill checkoff list that I do with you after we learn suturing, for example. At that point, I can then sign the assessment. But I don't want you just practicing in class. I want you also practicing in clinical. So anytime that you do a skill, so if you look through, there's a long list of skills, and some of them is as easy as like a history taking or things like that that you will be doing every day. Each week in clinical class, you're required to submit 5, and you're supposed to, and you will tell me about them. So what I would do, I would print this sheet out, keep it with you in your backpack, your planner, whatever you have for the whole semester, because you're going to have to keep it with you. You will submit the completed sheet at the end of the semester, not now. So each week, all you're going to do is report to me what you have learned. So I practiced this, I practiced that, and that's all you're going to have to do, and tell me about what it was and how you learned it. The reason I'm not telling you which skill to do each week is because that's not always going to happen in clinical practice, and I wanted to account for that. But you do notice on the assessment there is the simulated or live. So let's say that you are working with a patient on wound care. You didn't talk through with your preceptor on how to learn how to do it, but you had already practiced it. And so you are then able, if they go in and they're like, yeah, this was done really well, this needs improvement, this is good, that is considered an assessment to where they could say, yep, you did this well. They're going to sign off and date it for you on that. And so it's just something quick and easy. There's no other papers they have to fill out, just saying, yep, we saw you do this. Now, they cannot assess something that you are learning. So let's go back to the skill. If they're saying, hey, let's talk through how to do steri strips, and you talk through it and do it with them, that does not count as a learning and an assessment. That can only be the learning at that point. They have to be 2 separate times. Now, if you're going through and you're doing mock patients, 100% you can do the assessment on mock patients, learn on whichever type, it doesn't matter. I do have like method of learning. So did they talk with you? Did they give you an article? How did they have you complete this? And so in Clinical 2 right now, you have the Clinical 2 sheet. In a couple of weeks, you are going to get the sheet for Clinical 3 for next fall, because you've already are learning these in the classroom, and so you're able to then take that information and begin it in clinical practice. You will not have to turn in clinical sheet 3 by the end of the semester. So what I want you to think of is not let me fill all 5 boxes on each of them. It's let me try to spread out what I'm learning. Now you can complete more than you want in a week. That is absolutely fine. You can do more than 5. You only have to report on 5, and that's just to keep you guys in check. So because of not turning it in on time this week, I'm not going to make the deadline of that part of the assignment due this week. That's going to bump into next week. So this week you just have to do the second part in the documentation, but you'll have to do 10 competencies for your assignment for next week. So I hope that clears up some confusion. You're going to have to be responsible. You're going to have to keep the papers. Like I said, I recommend printing them out and keeping with you. And at the end of that clinical class, that is what you will be submitting. So please reach out if you have any questions, and I'll be happy to answer them for you. Have a good one.